SPTA Travis here. Today in this video we're going to be talking about the phases of healing and the appropriate treatments for those phases. So coming up here to this first layer, this is just going to describe the different phases of healing. You see they're split up into 3 distinct phases. So we start with an injury, and then within about the first week, that is going to be called the acute inflammatory phase. That's exactly what it sounds like. You should notice the 5 cardinal signs of inflammation. That's going to be pain, redness, swelling, heat, and loss of function. And then moving on from there, this is going to be typically, after that first week and maybe up to about 21 days. This is the subacute proliferation, repair, and healing phase. It's kind of a long way to put it. This is just the phase where your body begins to kind of rebuild itself from that injury. And in the middle of this phase, around like 14 days, this is when fibroblasts, which are a type of cell, are going to start to lay down new collagen fibers. This is going to allow us to begin to rebuild. Moving on from there, at the 21-day mark, we enter the chronic phase. This is going to be the actual phase where things start to really solidify. You can think of it like if you laid cement, this is where that cement begins to harden. So in relation to each of these different healing phases, these are always distinct and these always go day by day. So we have the 4 to 6 days for the acute phase, 4 to 6 days to 21 days for that subacute phase, and then 21 days and however long it takes from there for that chronic phase. However, for treatment, we're going to start at injury again, but these might kind of overlap. So these do not always correlate. For example, the maximum protection phase here, it's not always going to correlate directly with this time frame. This maximum protection phase is not always going to be 4 to 6 days. It could be up to 6 weeks, for example. So starting in this maximum protection phase, again, we're in this acute inflammatory phase. Appropriate interventions. So this is going to apply to being a PTA, working in physical therapy. Patient education is always going to be a go-to. That's always something you want to do. You want to kind of give them an idea of how long might this take to heal from this injury. Basics on the physiology, what happened to your body and what your body is going to try and do to fix that and how we're going to help it fix that. And precautions, of course, things you do not want to do in this acute inflammatory phase while we're under maximum protection. And one of those interventions is the classic, it used to be RICE, now it's PRICE. So the RICE obviously stands for rest, ice, compression, and elevation. The P there is for protection. Moving on from there, we have passive range of motion on the injured tissue, active range of motion where the patient is actually doing the motion themselves on the surrounding tissue, grade 1 and 2 mobilities, low intensity isometrics, emphasis on the low intensity while we're still in this maximum protection phase, and massage and modalities can never hurt as well. So moving on from there, we're going to gauge at about 7 weeks. We're into the moderate protection phase. And in the moderate protection phase, again, around 7 weeks is when we can kind of generalize it starts. And that can go, again, as long as it takes. It just depends case by case. And it's going to be under the doctor's discretion when it's safe to move into this phase and when it's safe to move out of this phase. So under moderate protection, again, this is when we really need to begin to kind of stress that tissue because we're laying down new fibers and we want the body to kind of get the message it's time to start healing, and we want it to heal nice and strong. Appropriate interventions, patient education as always. Always want to let them know what we're doing, why we're doing it, where the body's at with that. We want to begin to encourage normal activities. Again, when we're in this acute inflammatory phase back here, the patient's probably not going to be moving a lot. They might be confined to like a brace or a cast or some sort of fixator. They might not have a whole lot of mobility. So when we get into this moderate protection phase, we really want to ramp it up and start to get them moving, start to get them engaging that tissue again. So normal activities, want to get them moving again. Manage pain and inflammation. You want to keep a lookout for any new inflammation, or if you're kind of making things worse, we don't want to do that. We also want to begin active exercise. So active range of motion, again, that's the patient doing the motion themselves. Want to kind of work on muscle endurance as well, because again, if it's been in like a brace or a splint or something for a long time, you're going to have some atrophy, and we want to kind of get those muscles reconditioned. Protect the weight-bearing status. That's always going to be crucial. If a patient is, for example, a fractured tibia, you want to go off of what the doctor's saying. If they're saying it's still not good weight bearing, not full weight bearing, you don't want to just force that. You also want to move into stretching. If they haven't been moving that limb a whole lot, you might have some contractures, so we want to start working those muscles out again, and getting that tissue stretched. And neuro re-education as well. This is going to deal with things like proprioception. If you haven't bared any weight on your right lower extremity for a certain amount of time, you might feel a little uneasy when you first start to put weight back on it. So moving on again, if the doctor says, okay, we're good, we can move out of the moderate protection phase and into the return to function phase of treatment. Again, this is going to be determined by the doctor, not by the PTA. So this phase, it is critical now that we stress that tissue. During this whole healing phase and treatment phase, your body has kind of went through a lot, and you really want to get it back to that full normal function. So PT education, patient education, that is always going to be crucial for every single phase. In this one as well, want to make sure that they're sticking to their home exercise plan, for example, and that they know what we're shooting for, that they know their goals and how to achieve those goals. We want to focus on things like stretching as well. And plyometrics. So if you've got like a patient that is a runner, for example, in track, this is the phase where we can start to really get them to redevelop that explosive movement that you need for sprinting. So that's what plyometrics are going to kind of focus on. Now we're really putting some stress back on those injured tissues. That'll really help to solidify them. There's also something here in the return to function phase. It's called acute on chronic. So remember, back here in this acute and inflammatory phase, those 5 cardinal signs of inflammation. So acute on chronic, while we're in this chronic phase of healing where we're returning to function, this is going to be a complication that we might have, and this can come from overuse, trauma. You may have re-injured what was already injured in healing, poor mobility, and contractures. Those can all cause us to kind of re-exhibit signs of that acute inflammatory phase while we're in that chronic phase. If that is the case, unfortunately, in terms of treatment, we're going to have to resort all the way back to maximum protection. And that is just a brief summary of the healing phase, the treatment phases that go along with those, proper modalities and interventions, and how the PTA is involved.